Hello everyone, today's video is about abdominal region or abdominopelvic regions. I already shared two videos about anatomy, and if you want to watch this video, I pin the link of the series in comment section and also in description box. You can click this link and watch this video first. So start with abdominal region or abdominopelvic region. First, abdominal region. The abdomen portion that is present below the sternum and below the thoracic region is called the abdominal region. And below this there is pelvis present. So the portion where the pelvis present, this region is called the pelvic region. So in this video I will discuss about both abdominal region and the pelvic region. So let's start. Abdominal region or abdominopelvic region can be divided into the 9 regions. 1. Right hypochondriac region. 2. Right lumbar region. 3. Right iliac region. 4. Epigastric region. 5. Umbilical region. 6. Hypogastric region. 7. Hypochondriac region. 8. Left lumbar region. 9. Left iliac region. See in this picture that the region that is present on the right side of the body is called the right region. For example, right hypochondriac region, right lumbar region, right iliac region, and the organ that is present on the left side of the body is called the left region. For example, left hypochondriac region, left lumbar region, left iliac region. So first, right hypochondriac region, where the hypo means below or under and the chondriac means cartilage of ribs. The organ that is present under the cartilage of the ribs is called the right hypochondriac region. And organs include liver, right kidney, small and large intestine, gallbladder, all are present in right hypochondriac region. Then right lumbar region, it is present the right of the lumbar vertebra. And ascending colon, small intestine, right kidney is present in right lumbar region. See this picture that our vertebra or the spine can be divided into the 5 parts. First, cervical vertebra, second, thoracic vertebra, third, lumbar vertebra, fourth, sacral vertebra, and fifth, coccyx. So the right area of the lumbar vertebra is called right lumbar region and the left area of the lumbar vertebra is called left lumbar region. Then right iliac region or inguinal region. Right of the iliac crust on hip. Iliac crust is the prominent upper edge of the ilium, which is the bone of the pelvis. So this region is present the right of the iliac crust of the hip bone. Organs include appendix, circum, ascending colon and small intestine. These organs are present in right iliac region. Then in middle portion, epigastric region, where the epi means above or over, gastric means the stomach or belly. So this region is present above the stomach. The organ include liver, stomach, pancreas, duodenum, spleen and adrenal gland. These are included in epigastric region. Then umbilical region, due to the presence of umbilicus or navel. So this is the middle of the abdominal region. The organs include duodenum, small intestine and transverse colon. Then hypogastric region, where the hypo means below or under and the gastric means stomach or belly. So this region is present below the stomach or belly. The organs include bladder, sigmoid colon, small intestine and reproductive organs. Then left hypochondriac region, where hypo means below or under and the chondriac means cartilage of ribs. So this left hypochondriac region is present in the left and the below of the cartilage of ribs. That's why it's called left hypochondriac region. The organs include tips of the liver, left kidney, small and the large intestine, spleen, pancreas and the stomach. Then left lumbar region. Left side of the lumbar vertebra is called the left lumbar region. The organ include descending colon, small intestine and left kidney. Then left iliac region. It is present left of the iliac crust on the hip bone. Iliac crust is the prominent upper edge of the ilium, which is the bone of the pelvis. So the iliac region that is present the left of the iliac crust of the hip bone. And what is iliac crust? Iliac crust is the prominent upper edge of the ilium, which is the bone of pelvis. And the organ include sigmoid bone, descending colon, small intestine. So I discussed about all 9 divisions of the abdominal region. Right hypochondriac region, right lumbar region, right iliac region that is present in the right side of the body. Then epigastric region that is present above the stomach. Then umbilical region where present umbilicus. Then hypogastric region which is present below the stomach. And then left hypochondriac region, left lumbar region and left iliac region which is present the left side of the body. So the position and the organs include all of these regions are most important. Then abdominal quadrant or abdominopelvic quadrants. And abdominal quadrants can be divided into the 4 quadrants. See in this picture that this is the median plane and this is the transumbilical plane. which helps to divide abdominal quadrant into four parts. First, right upper quadrant. It is present the right side of the median plane and the upper side of the transumbilical plane. Then right lower quadrant, that is present the right side of the median plane and the below of the transumbilical plane. Then left upper quadrant, that is present the left side of the body and also the left side of the median plane and the upper side of the transumbilical plane. Then left lower quadrant, that is present the left side of the body and also the left side of the median plane and the below of transumbilical plane. So the right upper quadrant is also called RUQ, R for right, U for upper and Q for quadrant. And right lower quadrant is also called RLQ, R for right, L for lower, Q for quadrant. And then left upper quadrant is also called LUQ, L for left, U for upper, Q for quadrant. Then left lower quadrant is also called LLQ, L for left, L for lower and Q for quadrant. And what is the importance of the abdominal quadrant? It is important because it can help accessing the patient with the abdominal pain. So start with right upper quadrant. This is also called RQU, R for right, U for upper and Q for quadrant. The right upper quadrant, that is present the right side of the median plane and the upper portion of the transverse plane. And it is also contains gallbladder, right kidney, part of the liver, part of the stomach and part of the colon. And please note, a common causes of the right upper quadrant pain is gallbladder stone or gallbladder infection. Then right lower quadrant is also called RLQ, R for right, L for lower, Q for quadrant. It is present the lower side of the transumbilical plane and the right side of the median plane. So it contains appendix, right ovary and part of the colon. And note, a common causes of the right lower quadrant is acute appendicitis. Appendicitis development or sometimes due to the ovarian pain where the right ovary is affected. So the common causes of the pain of the right lower quadrant is acute appendicitis where our appendicitis become developed or sometimes due to the ovarian pain where the right ovary become affected. Then left upper quadrant. It is also called LQU. L for left, U for upper and Q for quadrant. It is placed in the left side of the median plane and the upper portion of the transumbilical plane. And it contains spleen, left kidney, most of the stomach, part of the liver, main part of the pancreas, small and the large colon. Then left lower quadrant or LLQ, L for left, L for lower and Q for quadrant. It is placed on the left side of the median plane and below the transumbilical plane. And it is also contains of left ovary, left ureter, part of the large colon. A common causes of the left lower quadrant is the inflammation of the lining of the large bowel or colon or sometimes due to the ovarian pain when the left ovary is affected. So the common causes of the left lower quadrant is the inflammation of the lining of the large bowel or sometimes due to the ovarian pain. So that's all. If this video is helpful to you, please like, comment and subscribe my channel and also share more and more with your friends. Thank you everyone.